A pleasant afternoon to the panel of judges. We are from Group 5 and are here to present our intelligent machine robotics and intelligent machines research entitled PatHMos, which means Patient Health and Environment Monitoring System.
To begin with, this study aims to integrate IoT-supported sensors to collect and transmit real-time patient and environmental data, improving healthcare outcomes. IoT-supported patient health and environment monitoring system, or PatHMos, is designed for remote patient health monitoring, especially during contagious outbreaks like COVID-19. It combines portable sensors and smart medical devices with secure data transmission to address risks associated with traditional surveillance methods. By continuously gathering patient health data and analyzing it in real time, medical practitioners can remotely monitor and intervene as needed, reducing the need for in person visits and improving patient outcomes. Next slide, please. After the introduction that gave the researchers a better view on what must be done, conceptual framework is needed to give a more systematic approach on that device. First, the researchers need to have a surface knowledge about programming, designing, wiring, and soldering. Then one must prepare the hardware requirements. The ESP32 for Wi-Fi and Bluetooth connectivity, the MAX3010-2 for pulse oximeter and also acts as a heart rate sensor, the MQ2 flying fish for that acts as a gas sensor, the DHT11 that measures the temperature and humidity around the area where the device is in, the LCD module to display whatever data that needs to be displayed, and jumper bars. Moreover, this device only needs one material, which is the 3D printing filament that is needed for 3D printing the case of the device. And lastly, this study needs the researchers to have computer or laptop to execute the coding needed for each sensor. After the input will be the process. The process is divided into two categories. The project design that includes the planning, gathering of materials, and designing the device, and the project development that includes programming the code, prototype testing, and finalizing the paper. Now, after the researchers have overseen these two former requirements, IoT-supported patient health and environment monitoring system, or PatHMos, will now be made. Next slide, please. The statement of the problem will now be presented.
Good morning, panel. Speaking of PatHMos, the study all came from one desired plan of creating a device that has a purpose of aiding the health workers by collecting and sorting data on specific patient conditions and the environment they are settled in. So when something out of the ordinary occurs to the patient or their environment, the device can send a signal to their designated doctors. The development of this device gave rise to these questions. Number one, how precise can the prototype gather the patient's data in terms of the following? Number two, how about in terms of the patient's environment parameters, such as the following? Number three, what parameters are included in the prototype's display concerning the patient health and their environment? Number four, how capable is the prototype in terms of its speed and storage on data gathering, and can the users trust the prototype's interface? Number five, in terms of its characteristics, is the prototype convenient? Does its design match its purpose? And does it pass the durability test that is the drop test? Is it portable? Number six, moving on to its battery, does it correspond with the prototype? How long will its charging time be, and how long will the battery life last?
Now, moving on to the scope and limitation. The study focuses on the functions of the IoT-supported PatHMos and its benefits in improving medical monitoring efficiency. The system will consist of health sensors that track a patient's temperature and heartbeat. It will also monitor the patient's environment for safety, including humidity and air quality. The user interface of the monitoring system will display real-time health parameters to the patient, caregiver, and family members, and it will also ensure data security through encryption. In case of emergency, the system will send alert to the patient's caregiver or emergency personnel. However, the study will not involve in-depth health analysis or specific sensors for more specialized health conditions. It will only focus on assessing patients and caregivers and monitoring vital health and environment conditions. Next slide, please.
What group of people and institutions will this device benefit?
Great question. The IoT supported PatHMos will be beneficial towards the following. Firstly, healthcare facilities. The system allows healthcare facilities to monitor a patient's vital sign even when they are outside the facility. This is particularly beneficial for hospitals with limited resources and space. Secondly, we have medical practitioners. The monitoring system simplifies the process of tracking a patient's health condition even when they are outside or even when they are not within the practitioner's immediate reach. This saves them time and helps them to focus on other patients. Thirdly, we have patients. PatMos provides the patients with the convenience of receiving medical aid in the comfort of their own home. This is particularly beneficial for those patients that require minimal treatment but constant attention and those who cannot afford to stay in the healthcare facilities. Lastly, we have future research. The findings of this research can serve as a foundation for future researchers interested in developing or creating products for the medical field. Next, we have research design.
Apologies. Let us segue to the research method and design. Here, the researchers utilized descriptive developmental research design in order to further understand and investigate PatHMos as the IoT supported patient health and environment monitoring system in its current state, and how it may be improved using the data and identified issues from observations and comprehensive developments with regards to the latest advancements in the IoT healthcare systems, such as PatHMos in itself. Next slide, please. As for the pictorial diagram, here is the current schematics of the device. From the last schematics, there has been a few changes. First and foremost, instead of a breadboard, there is now an expansion board in which the modules have been soldered in for for the safety of the device. Next, MQ2 Flying Fish remains the same as is the LCD module, but the most utilized is the Max 30102, in which instead of it just being a pulse sensor, it is now also the patient temperature sensor instead of the last module we used, which is uh, the thermometer like one, which had a long wire, and we were proposing it to be in the spool. Instead, we utilized the Max 30102 to its fullest potential. And rather than the temperature sensor, we the researchers changed it to the DHT11, in which it measures the humidity and environmental temperature around the device. Next slide, please. As for the prototype casing and design, this is the current casing for the design, in which it is more compact and m- more efficient in terms of use as well. It also fits the uh, boards and the modules in itself very snug, so it is safe in its casing and it doesn't move around because the board itself is screwed to the casing. That's all for the design as of right now. Thank you.
Okay, now let's proceed to the procedural chart. This outlines the steps involved in creating PatMos. Number one is the planning. This phase involves defining project goals, identifying required functionalities, and determining key parameters to monitor. Next is the analyzation. This consists of sensor specifications and schematic diagrams. Third is the purchasing. These components are the required materials. This is compiled into a list and purchased from reliable suppliers. Compatibility and specifications of purchased items are also verified. Next is the designing. This includes schematic diagrams for circuit layout and sensors placement are created. Lastly is the implementation. The ESP32 and sensors such as the MAX3010-2, DHT11, and the MQ2 Flying Fish are set up. The LCD module is configured for patient information display. And a 3D design of the base is made. And finally, testing is conducted to ensure functionality. Next is the requirement specification. In the specifications, the device will utilize a battery voltage ranging from 3 to 5 volts. The device will also be powered by an ESP32 microcontroller. A MAX3010-2 sensor will be used for monitoring heart rate and temperature. Expansion board will facilitate the connectivity for the device. DHT11 sensor will be employed for sensing humidity and environment temperature. Sixth is the MQ2 flying fish sensor that will be utilized for detecting gas and smoke. LCD will be incorporated into the device for displaying real-time data. Jumper wires will be used for connecting various components of the device. And lastly, the initial prototyping of the device that will be connected using a breadboard. Now let's proceed to our statistical treatment of data. The mean will be calculated to determine the average values of patient health parameters, such as the temperature, heartbeat, oxygen saturation level. And also, this will calculate the environmental variables, such as the temperature, humidity, smoke, and CO2 content. When it comes to our standard deviation, this will be computed to quantify the variability in patient health parameters and environmental variables. It will help in understanding the spread of data points around the mean, identifying outliers or anomalies. By utilizing the statistical measures, the study aims to gain insights into the distribution and characteristics of the collected data, facilitating a comprehensive understanding of patient health and environmental conditions. Now let's proceed to our next presenter for the chapter 4.
Let us now proceed with Chapter 4, the presentation, interpretation, and analysis of data of the researcher's prototype, which is PatHMos. All right, Table 4 and Table 5 represents the analysis of the researcher's SOP question number 1. From Table 4, the summary that can be concluded in this table is that the lowest data that was gathered is from Trial 1, which is 36.8 degrees Celsius, and the highest result is from Trial 2, which is 37.2 degrees Celsius. All in all of the trials are within range in the expected result, meaning that each trial was accurate enough to represent the patient's temperature. Also goes for table 5, uh, the heartbeat rate sensor. It also goes for the accuracy of the heartbeat data. For all are within range in the expected result, meaning that each trial was also accurate enough to represent the heartbeat sensor. All of this table 4 and table 5 was gathered from the sensor MAX30102. Moving on to figures, figure 7, sorry, represents the environment temperature data uh, and it's also accurate enough to represent the environment temperature sensor. For figure 8 and table 7, uh, it represents the accuracy of the humidity sensor. From the expected result, notice that the expected value has a higher range of data compared to a normal room temperature. It is because the situation the Philippines is in right now, which is the high heat index temperature. The researchers concluded that to have a range that corresponds to the situation of the Philippines right now, which is 70% to 90%. For table 9, please. It represents the sensor proximity, meaning how long of a distance does a sensor can cover. Patient health parameters, such as the temperature sensor or the heartbeat sensor, it needs physical contact of the patient to the sensor, which is the MAX 30102. While the environment sensors covers at about a maximum of 20 square meters. That data was gathered from the coding of the sensor itself. For table 10, please. For table 10, it shows the projection of data that the LCD displays with its responding speed. Well, in conclusion to all of that, all the parameters that is needed to portray is successfully displayed by the LCD module. Table 11 presents the efficiency of the prototype. Due to the features of the prototype it provides, such as its size, etc., it fits the user's needs, hence can be concluded as efficient. For figure 10, please. All right. For figure 10, it represents the durability test, the test drop. The data is presented here are needed in order to calculate the impact force that is bestowed upon the product. Each ascending trial presents a higher height to fall upon, 1 feet to 4 feet. Therefore, each trial increases the impact force one by one. Still, overall, all trials concluded of the device throughout the testing period remains functional. For table 13, please. All right. Table 13 represents the battery evaluation of the prototype. During the testing, battery only lasted 20 hours while being connected to the device, while other terms such as usage, etc., remained the same of those in commercial brands, such as 300 to 500 charge discharge or discharge cycle in the usage time. In charge time, it only needs for 1 or 2 hours to fully charge the battery itself. Charge capacity or the battery life can last to 2 to 3 years. For the table 14, please table 14. The data retrieval of each sensor and its accuracy. Of course, each sensors have its different roles to execute. The prototype that may require heavier data to upload. That's why each sensor differs in speed. But still, the highest speed to display the sensor's data is the heartbeat sensor, and the slowest, what I mean is slowest would be the gas sensor. And all the standard deviation remained low, which is close to its peak accuracy, hence can still be reliable in terms of real-time data retrieval. Now for the next topic would be chapter 5.
Um, with the rapid advancement in medical Internet of Things and after a careful data analysis conducted by the researchers to test the hypothesis, the researchers were able to come up with a conclusion to answer the following questions. Number one, effectiveness in health monitoring. The PatHMos system successfully assesses crucial health parameters including temperature and heartbeat, providing accurate insights into the patient's health status. Number two, environmental monitoring capabilities. The system effectively evaluates the environmental factors such as temperature, humidity, smoke, and gas presence, along with ensuring the sensor's proximity, contributing to a safer and healthier living space for the patient. Number three, information display and accessibility. The collected data on both patient and is effectively displayed on the LCD module, which gives caregivers or medical professionals quick decision when it comes to abnormalities in these parameters. Number four, characteristics evaluation. The system is found to be convenient, well designed, durable, portable, enhancing its usability and, and adaptability in various settings. Given its miniature size, its round edges, it is surely user friendly. Number five, battery efficiency. Evaluation of the device's battery indicates satisfactory usage. Reasonable charging time given it only takes 1 to 2 hours, and dedicate charging capacity ensuring prolonged battery life for uninterrupted monitoring. The battery could go on for 20 hours without turning off the device. Number six, data retrieval time. The system records data retrieval time indicating its responsiveness and efficiency in providing real-time information for monitoring and analysis. The the device accurately gathers data and then projects it to the LCD module depending on how fast the sensor gathers the data. And given that there are advancements in medical Internet of Things overall, PatHMos proves that its effectivity as a temporary solution for health and environment monitoring. However, further refinements must be done in order to cope with the recent world innovations, which leads the researchers to the following recommendations. Number one, further user feedback and testing. Number two, enhanced data analysis and capabilities. Number three, integration with existing healthcare systems. Number four, scalability and adaptability, and number five, continuous improvement and innovation. And before the researchers conclude their presentation, we would like to present the device itself.
Okay, here is the login screen for the PatHMos website. This is for major use only. So when there is a patient, sorry, I didn't realize I was holding that. When there is a patient, this one's easier to use because it's just rudimentary. You can see it's straightforward. So for the protection of the patient and the doctor accessing the results, we have a login screen. Um, as you can see, I'm already logged in, but it's gonna lead you to a secondary login screen, and it's gonna say login with such so either Facebook or Gmail or another email, and you can press sign up to do that. But the website itself, when live, the sign up screen will not be there because the account will be given by the hospital or the medical facility in order to protect the safety of not only the doctors but the data of the patient. So I will log in, give it a moment. Here you can see it opens to the screen. As you can see, I'm logged in. Uh, if I press this, it leads to the account. Oh no. Oops. It leads to the account of the doctor in itself. And to find the patient, we'll be using the PatHMos number, which will be assigned per PatHMos device. So TMS, then dash, then four numbers, let's say 0020 dash, another four numbers, 0700, 70, another dash, and 0001. So, oh wait, sobra. Anyway, like that. So, uh, I'll copy this. If wala siya, it's gonna turn red. But if tama yung format, it's gonna be green, and you can proceed to find the patient. Here you can see the um, patient profile, in which it's the patient's name, the room number, the age, so on and so forth. And usually here, you can put the picture of the patient, which should be uploaded to the interfaces when there's medical history in the hospital already. And if clicked, will lead to a bigger screen, which just shows the patient profile, but more in depth, though not coded yet, as there's no hypothetical patient to encode as of the moment. So we have four options here: the monitor patient. Um, Here it should be linked to the device itself, but as we don't really have a database for it yet, we are unable to link it as databases get expensive and it takes about 20,000 a year to maintain it, if I'm correct. I'm not sure if it's a year or a month, but it's 20,000. Then patient medication. As you can see in all screens, it shows the patient profile, and the medication schedule shows the medication and dosage and the time when it should be taken. This should show per day and should change as needed, as encoded by the doctor. Next is patient medical history. Again, this shows the date first, and when clicked, leads to the history for that date. Though, since there's no encoded medical history yet, it remains like this. And once these slots are full, it creates a drop down bar in which you can navigate it by year, month, and day in order to utilize and make it more efficient as a site. Um, Next is patient checkup. Again, this shows the incoming patient checkups. So this is only for incoming, and once the checkup is done, it goes into medical history. So far, that's all for this website because this is mostly just for the usage. So it's easier to navigate and less features in order to for it to be more easily understood. That's all for this website.
Do you see it, guys? Um,
Yes,
so,
see.
Yes
all
po.
right.
Yes.
So in here we can type the example in my email. Let's say the email that would be inputted here is the Sergio Josh. So gmail.com. Might be overstretched, but it's just an example for now. And remember, password or not, you can always just not for. If you forgot your password, it would prompt into the password recovery into which you need to verify your email first before you can get some verification codes on it. But for now, we use this as a login device. Input your password, then you can go for login. As this is the homepage for the PatHMos website, these charts represents the data parameters or the usage of PatHMos itself. And in this table, you could see the names and the people that are using right now the PatHmos example. The medical practitioner, which is logged in as now, uh, would be able to see her by just searching her name. So let's say search her name for Eva. All right. The uh, the data that was prompted here is that the name, the illness that the patient has, the location, the age, the start of usage, and the device ID. Those are more importantly needed for the medical practitioner to search for the name patient. And say and his expertise on medical level is hematologist, and his full name and address should be in here, and his schedules. And let's say in this web page, you can see patient's what do you call this, patient's parameters in currently now in real time data, and the doctor's capabilities, and the doctors come through in terms of social medias. And if you click on the message, it would prompt you into a website that would already prompted the email email name of Sir Josh. But for now, let's just stick to the now this for the homepage, and now this is for the name of patient. You can also search this name of patient by searching an example, John Doe. John Doe is the name of a patient, and if we search this, it would take us to the data parameters of John Doe with its full on detail. Let's say his room number, his age, his blood type, his health parameters, check next appointment, and such as schedules and such. For the next one, it would be the connect to a PatHmos device. PatHmos ID can always search for anything at all, and the password, and the password of the PatHmos itself. And if you click submit, it will return you as well to the name of patient and its full on detailed parameters. And if you want to log out, then you can always just click on log in, then it already would be logged out right now. Actually, that's pretty much it. The for my website.